Catching an early morning wave before work was something Dr. 𝗶𝗵𝗶𝘀 could only dream of 4 years ago. At the time, he was working a 16-hour day specializing in eye surgery and developing a medical app at night. After 3 years of this grueling schedule, his spine literally collapsed.
I wasn't able to walk for 6 months. And I used to take my 𝗀𝗵𝗶𝘀 down to the beach and I would watch the surfers and I said, one day, if I can walk again, I want to teach myself to surf.
And without the support of his wife Marika, a fashion designer, he wouldn't be able to immerse himself in the next challenge. 𝗵𝗶𝘀 is the CEO of Vula Mobile, an app designed to give immediate support to frontline healthcare workers from public health specialists. It all began 7 years ago as a young doctor doing community service in a remote hospital and desperately needing specialist advice for his patients.
I said to myself, once Vula's seeing more patients daily than I saw in Swaziland, which was 80 a day, then maybe it's time for me to work on Vula full time. And Vula's currently seeing a patient every minute now. So it's really expanded beyond what I could do as one doctor.
For example, let's say a frontline doctor was treating a burn victim. They select the closest hospital with a Vula burn specialist, select the burns page, fill in how extensive and severe the burns are, and the specialist on call now has the critical information to prescribe treatment. If they need to know more, they use the live chat function, and it's as efficient in the 53 other areas of medicine as it is in burns.
Typically, what is the ratio between patients and specialists?
If you look at internal medicine, orthopedics, there are more specialists in general. And then if you go to the smaller specialties like dermatology, ophthalmology, rheumatology, there we don't have enough specialists at the moment. But the nice thing about Vula is despite those scarce resources, we can maximize the use of those resources.
The beauty is, it's designed in very close collaboration with the specialists, something 𝗵𝗶𝗀𝗀 calls the IKEA effect. If you build it yourself, you value it more. All the most critical information is programmed in and immediately available for the specialist to make a decision on the next line of treatment.
In a third of the cases, the frontline healthcare workers who are seeing patients don't have to refer the patient to a tertiary center. The specialist can actually give them advice and they can treat the patients at their primary healthcare center.
The Tygerberg Hospital serves a population of around 3.5 million people, and it's massively overburdened. In the past, patients would just pitch up. But since using the Vula app, it has lessened the load for the various units using it.
Not only has it changed the lives of the referring doctors, it has upsides for the specialists too. Like orthopedic surgeon Dr. Etienne Joubert.
You can now see which patients are emergencies that need to come straight away, or if it's a patient that can be seen at our clinic on a planned date, or what one can also do through the app is to tell the referring doctor what needs to be done.
It's reduced their patient load by 20%. Dr. 𝗶𝗵𝗶𝗀𝗆𝗆 is the registrar on call today and keeps an eye on the Vula app while working through the people attending the clinic.
50-year-old male, looks like a fracture by the ankle.
Dr. 𝗶𝗶𝗀𝗆 is giving advice to the referring clinic on this fracture. It needs surgery, but it's not all bad news.
It looks like a patient that can also just come the following day to our clinic for an admission.
It saves the patient the expense and the time to find transport to get to hospital, spend potentially a lot of time waiting to be seen, and then have to get back again.
And when you're poor, that's very expensive. And if the hospital is a 4 to 7 hour drive away, like in some provinces, and 80% of the population is dependent on public health, it's having a massive impact.
A phone ringing off the hook is one of the most stressful sounds. But for overworked medical staff and specialists, they just don't have the time to pick up the phone when the emergency in front of them is far more pressing.
Once they click on hospital they want to go to, it lists all the doctors that are on call right now. In the past, you'd often spend 45 minutes trying to get through hospital switchboards, get to the right doctor, and then you might not have the right information that that specialist needed.
But with Vula, doctors aren't having to make phone calls, navigate switchboards, or page specialists to call back after theatre or ward rounds. When the COVID pandemic hit and the healthcare system was stretched to breaking point, they created a dedicated COVID page.
It's a godsend. The fact that you can have all that information at your fingertips and then, review that with active feedback from the person that's referring on the other side. It simplifies the process.
It's so encouraging to see all these empty hospital beds. But during the peak of the third wave, Dr. Abdullah admitted 125 patients in one day. And thanks to the Vula app, by the time the patients arrived here, all their vital information was already available.
Level of care required.
That information was uploaded by the referring doctors, ready for use by Dr. Abdullah and his colleagues at Cape Town's dedicated COVID hospital, Brackengate.
I think this pandemic has kind of proven that South African doctors are made of grit and steel, and nurses are made of courage, and they go way beyond the call of duty to ensure that the people that we look after are looked after as best as they can.
And that dedication is reflected in the stats available on the app at the end of each month. Who took the most cases, how quickly they responded, and where things fell apart.
All the departments using Vula get all their stats from the previous month, so they can see where all the referral patterns are happening. They can see where the workload is increasing or decreasing. The data has been used to motivate for extra posts in certain areas. So I think the level above just the use of Vula by healthcare workers is actually by the health administrators. So they can redesign the healthcare system almost in real time with data.
The Western Cape government has adopted it as its official referral platform, and it's operating in 6 provinces. It's also spreading across Africa.
Dr. 𝗵𝗶𝗀's heart has always been in the public healthcare sector, and he's made enormous sacrifices to get the app to where it is today, never succumbing to the allure of the private sector, and it's paying off.
Obviously, being a doctor, you're not really sure how to start a business, and it's all kind of new. And so there were times when Vula wasn't really making any money, and so I wasn't really sure how to do that. We've now got a company board, we've got a great team, we have a finance officer. So there's so much more support now than ever before. So I think if there's any kind of lesson I learned, it's ask for help, and there are always people in the background who are willing to give it. I know we've had a big board meeting recently. How are things going?
And his team is spread around the country. And unlike most tech environments, Vula employs more women than men.
What's been the biggest reward for you?
I think the biggest reward for me is actually getting the feedback from the healthcare workers and getting a sense of how Vula helps them.
I can 100% say that this little gem of an app has been an absolute integral part of our fundamental day-to-day working mechanism here.